Mid-thoracic spine pain is one of the most difficult things to assess and treat. Unfortunately, when we have pain in this area, it could be from the middle back. It could be postural. It could also be from the neck. So that's what today's blog is about. This is a very frustrating diagnosis for practitioners and also patients. So today we're going to talk about dorsal scapular neuropathy. Unfortunately, we have a peripheral neuropathy of C5 that can cause pain right in this area, that mid-scapular area, and it could be coming from up here. Let's figure out how this happens. When we have the dorsal scapular nerve, it drops out of C5, it goes through the middle scalene, and then it drops down the levator scapula and ends up down in this area. When we start to get that nagging, burning discomfort in this area, a patient comes in and I tried rubbing it, I rub it on the wall, a massage, a manipulation, nothing seems to get that pain to go away. Let's look a little superior. So the 4 ways that we can assess for dorsal scapular neuropathy, the first one is actually the easiest. It was defined by Ming a long time ago, and it's called looking at the cervical point in the back. So right between T5 and 6, 2 centimeters lateral, is the pain in this area. We can also look at signs and symptoms associated with scapular winging. If you want to take a deeper dive into that, check out the scapular dyskinesis protocol already in ChiroUp. Today's blog and today's video is really going to focus on the next 2. The first is how can we assess for a cervical radiculopathy? Most radiculopathies are a double crush injury. So the best test for that is the maximal foraminal compression test. We have the patient maximally rotate their head towards the side of discomfort, and then he's going to extend and look up towards the ceiling. What that's going to do is close down that intervertebral foramen, and we're looking for reproduction of symptoms extending down into the area of chief complaint. Now, how can we see if this has been going on for a long period of time, and do I truly have dorsal scapular neuropathy? You can look for weakness in the muscles that nerve supplies, which in this case happens to be the rhomboids. Remember, it drops right through that middle scalene, down the levator scapula, and drops into this area, and this is the myotome that it supplies. So I can do this 2 ways. The first one is good, it's just not great, but I'll show it anyway. I'm going to have the patient put their hand on their hip like this, and if I'm looking for activation within the rhomboids, I'm going to support his shoulder and have him take his elbow and bring it back towards me, and go ahead, and you can see how he activates those muscles along the periscapular border, right along the medial side. That's okay, but as we know, if you are seated or standing, there's a lot of other postural muscles associated with keeping you upright and vertical. A better way to test this, can have you lay on your stomach, is in the prone position. When you're in the prone position, it takes away all those postural muscles. So what I can have my patient do, assuming it's on the right side again, he's going to put his right hand in the small of his back. What I'm going to have him do now is he's going to roll the shoulder forward. We're now putting the shoulder blade into protraction, and I'm just going to palpate right in that medial border. And as I have him elbow up towards the ceiling, he's going to bring his shoulder blade back into retraction and then back into protraction. And I can feel for that muscle activity. And go ahead, and you can see my thumb move and coming back. And again, and back. So that's a great way to test for any kind of atrophy or weakness within those muscles. Remember, if this is an acute case, it's probably not going to result in atrophy or weakness. A long-standing case, though, may result in weakness. So things to look out for. This is one of the most frustrating diagnoses for you and your patient. Remember, the patient has pain here. Now we need to tell them and diagnose them the problem's actually in their neck. So doing the things that are most important are going to be manipulation of the neck, manipulation of the thoracic spine as needed, and then going into some rehabilitation exercises, some nerve flossing, and you can find those all in ChiroUp. Thanks for watching.